25 years ago, I ran my own care agency, and let me tell you, it broke me. Every day was a marathon of manual paperwork, frantic scheduling, and also chasing invoices. It was a nightmare. Then came 2008. The recession hit me, and our contracts were slashed into half. The one thing is that 99% of my contracts that I had, although I seemed really successful, was with one large organization. And I was chasing overdue invoices that were 3 months late, 6 months late even. Imagine that. I had 20 office staff in the office at the time, and the payroll was 30,000 a month I was spending on payroll for the office staff alone. Now, I'm not talking about the carers, the nurses that were in the community doing the hard work. I'm talking about the office staff alone in the office was costing me 30,000 a month alone. And suddenly it became very difficult. I was given 3 months notice. I knew that there was no way that I could cover this at all. There was no safety net, no digital ally back then. Just stress, burnout, and constant fear that one mistake could shut us down. I knew that this was heading this way. So I know I'm not alone in this, because even today, 25 years on, we are still stressed. We still have piles of paperwork, even though we were told when we were children, this is going to be a paperless society. Now, there's late night staff as well. Empty chairs. Just imagine. I was looking at this. And I know that you're not alone in this. I was working till 10, 11, sometimes midnight, 1 o'clock in the morning even, trying to figure a way out of this by myself. My staff, they would leave 5 p.m, the clock ticked to 5, and they were out the door. But I couldn't just walk out of there not giving it a try. So I know you're not alone in this, and right now healthcare leaders everywhere are drowning in the same daily battles. Shrinking reimbursements, for example, record staff shortages that you're trying to cover, burnout at every level, and admin overload that really steals from the care that you want to give. They're not just headaches, they're threats to your survival. Now, imagine this is still today. 58% of healthcare practices say payers are their number one obstacle. Still today. I know what that felt like, because that was my obstacle as well. 58% say that severe staffing shortages that they're having to face on a daily basis, and 42% report that rising cost of inflation is really eroding away at their profits. More taxes, more pay, you name it, everything has increased. So these numbers, they don't lie. They don't lie. The average provider now spends more than 2 days a week just on authorizations. Care coordinators they're buried in trying to schedule shifts. Frontline staff are burning out even today. And over half, and I'm talking about even nursing homes here as well, are operating at a loss. They're running on empty, but it doesn't have to stay that way. Don't do it the traditional way. And I'm going to explain to you the traditional versus AI automation agency. That's why I created these 17 AI agents, each one designed to solve your exact problem in your business that I once faced. Imagine this. Your shifts are being scheduled and they're being built by themselves. You're not having to rely on office staff. Now, I'm not saying to get rid of your office staff. I'm saying to be lean and efficient. Your business has to be lean and efficient. And AI is the way forward. Imagine compliance alerts that trigger before they're even in breach. You're seeing them ahead of time. Invoices that are sent out automatically and chasing payments too, making those calls, picking up the phone for you. An AI agent can do that for you. Constantly emailing, checking your inboxes, emailing out invoices, answering letters, emails, escalations for you, and prioritizing them. So you don't have to worry about how and who you should cope with first, because they're all urgent, but it's in the order that you face them. And also the AI will respond, so it gives you time to deal with any complaints or escalations. Imagine having a AI agent that can make those sales calls for you. 300 an hour. Imagine. Care assessments that write themselves instantly and accurately. So this isn't about replacing your team. It's about freeing them to care, to lead, to innovate. And it's about giving you, the CEO, the power to not just survive, but to thrive. We don't want to just survive. We didn't go into this business to just survive. We might as well get a job for someone else. But you want to thrive, but in a stress-free environment. So my mission is simple. It really is. No healthcare leader should have to do this alone. For less than a cost of a single full-time admin, you can deploy a team of AI agents that never sleep, never go on holiday, never go off sick, that is fast but effective, never burns out, and never forgets a detail. So if you are tired of paperwork, if you are overwhelmed by staffing, agency shortages, for example, or even looking for contracts, or needing help with your CQC submission applications, AI can do this for you as well. If you are laying awake at night wondering how to make it through the next quarter, you're not alone, and you don't have to stay stuck. Let's turn your pain points into your competitive edge. Let's build a future of healthcare together. I would like to invite you to join me online for a meeting, and I will give you a free demo showing you the AI agents that we have that can help support you in your business. We will also do a free AI audit of your business, of what the critical needs are. And look, just for one AI agent, $197, for example, for one AI agent that could really give you your time back. Isn't that worth that? Or even join me for our AI boot camps, our AI automation boot camps, for as little as $397. It's a 4-day boot camp where you get to build your own AI agents, because I'm here to help you to thrive in 2025. So join me. The link is here for you to book for a free demo and to talk about your care business's needs. Whether you are a startup, whether you are a small business, or whether you're a medium-sized business, I can help support you. So you're not alone. Let's build the future together. So click the link here, and I will see you in our next one-to-one free demonstration showing you what AI can do for you. Have a wonderful day now. Take care. Thank you. Bye.